Hi everyone, this is Dr. Stefan. Welcome to Interstitial Lung Disease Info. In this episode, I'd like to talk about drug-induced ILD, or medication-induced interstitial lung disease or pulmonary fibrosis, because this can actually happen. It's maybe a bit more common than we can identify because it's really hard sometimes to make the case that it's a specific medication that has caused the lung problem. It's not always easy because we need to establish a very clear timeline. And the problem is that a lot of people who develop these sort of problems in their lungs, they may be on several medications. So picking out from the bunch of them which one has caused the problem can be really difficult. And it's also possible that by the time that particular person who has developed the lung problem gets referred to a specialist center, has the right scans of their chest, it may be that the pulmonary fibrosis, the lung scarring, is already established. Maybe there's been a long time since they've been on that offending medication that has caused the problem in the lungs. And it's really hard then to say whether that was the case. And in many situations, it may not even change what we do in terms of management because we may not have optimum treatment options to go from there. What medication do we then use to treat this fibrosis that's already there? Is the fibrosis actually getting worse? Do we need to do anything about it? So these are all questions that come up. So it's a very nuanced answer, but let me just give you a couple of examples of medications for which there is a correlation with pulmonary fibrosis. So one of them would be nitrofurantoin. Nitrofurantoin is a medication that's used to treat urinary infections, urinary tract infections, water infections. So this one is very commonly associated with lung problems. It doesn't mean that it's not useful for treating urinary infections, and in most people, it doesn't cause a problem. But if it occurs in someone, if you have someone who has developed some issues with their breathing while being treated for a water infection with nitrofurantoin, it's something that's relevant. May require a chest X-ray, may require a chest scan at some point, depending on the presentation, depending on how long that person has been on treatment. And there are people who actually have water infections that are repeated, so they need to be on this sort of medication for maybe months or years. That's, again, highly relevant. So if someone has been on nitrofurantoin for maybe 5 years, probably the likelihood that if that person also has pulmonary fibrosis, there may be a connection. It may not be the only explanation. So it's always important not to stop medications that you need without talking to your doctor, without getting the right investigations, tests, having the right conversations. Another medication that is relevant is something called amiodarone. Amiodarone is a medication that is used to treat abnormal heart rhythms. It's very commonly used in cardiology. So a lot of people who have heart disease, they may be on amiodarone for extended periods of time. Now, this is a very useful medication to control the abnormal heart rhythms. So it can be dangerous to stop it, especially if your cardiologist really wants you to be on that drug because it prevents you from having a very severe episode of an arrhythmia in your heart. So it's really important, again, to look at this in context. Sometimes there can be alternatives to amiodarone to use other medications that may not be affecting the heart, be affecting the lungs, but it's important to have these conversations with your healthcare teams. So these are just two examples. But then there are also some other types of treatments which in some cases are considered by patients to be, or some doctors even, to be associated with pulmonary fibrosis because historically we've done so, but actually it may be another problem going on. It may not be the drug. Let me explain. Let me give you an example. This is the case of methotrexate. Methotrexate is a drug that has immunosuppressant properties. It's used generally to treat conditions in which there's an abnormal, dysregulated, intense activation of the immune system. So one common area in which we use methotrexate is to treat rheumatoid arthritis. It's a common drug for that. Rheumatoid arthritis is a condition that affects the joints. And people can struggle with significant symptoms, pain, swelling, stiffness in their fingers. It's really uncomfortable, people who have rheumatoid arthritis. And many people will end up going on methotrexate at some point. But there have been these cases in which methotrexate may have caused some lung damage in the past. The problem is, in that specific situation, rheumatoid arthritis as well can cause pulmonary fibrosis. So actually, it may be that being on methotrexate is better to prevent the rheumatoid-associated lung problem rather than not being on methotrexate to prevent it. So if that makes sense. So sometimes it's important to really have a good conversation with your rheumatologist, with the pulmonologist, the respiratory doctor who's involved in that case, to figure out whether actually that which treatment is the best for you? It may be that sometimes we think that it may be risky, but actually leaving the condition untreated may be risky as well. So when we're talking about pulmonary fibrosis, situations are not that easy. Another area where we talk a lot about drug-induced, medication-induced lung disease is cancer therapies. So especially with the newer immunotherapies. So these are, again, medications that are given to treat cancer. So again, serious condition, you want to get rid of the cancer, of course, but sometimes they can cause lung damage. So some of the newer agents that are used to use which take the brakes off the immune system, they can sometimes induce a significant activation of the immune system that works really well to destroy the cancer cells, but it can also damage healthy tissues such as the lungs. And there are all kinds of protocols in place, especially if you are on one of the newer agents to treat cancer, to monitor for the development of respiratory problems and what to do if that happens. So these are just a couple of examples. But the main thing about drug-induced ILD, about medication-induced pulmonary fibrosis, is that we need to establish a very clear timeline. When did the condition start? When did your symptoms start? What medications were you taking then? How did your medications change over time? It's really, really important to think about these things because it's no easy answer. And I can tell you this from practice. We sometimes get to see patients referred to our clinic when they already have pulmonary fibrosis, and then trying to establish what their medication history was over the last 10 years can be extremely difficult and extremely time consuming. So I would advise, if you are a patient who thinks that they may have a problem with their medication, is to try to actually write down the start and stop dates of your medications, if you have the time, if you want to do that. And if you present that to your doctor in your consultation, it will be a lot easier for them to figure out if there's a connection between when your symptoms started, when your chest x-rays or CTs started to become abnormal, and what medications you were at that time. Because in the absence of a given timeline that can explain that your lung changes appeared in connection to the medication, it may be really, really hard for your doctors to actually tell you that that's what the reason was. And like I said, pulmonary fibrosis can happen because of other conditions in the body, such as rheumatoid arthritis, that example where is it the methotrexate or is it the rheumatoid arthritis? And it's many cases, it's most likely the rheumatoid arthritis. So we need to treat that. So it may not be the drug. So it's really, really important to kind of think about what is the situation in your case, how things have evolved, when did the condition started, when did your symptoms start, what medications you were on then, what other occupational factors may have been involved, because it could be an occupational lung disease, it could be idiopathic, it could have no correlation to the medications that you're on. So complex field, very nuanced. I just wanted to make this point that with drug-induced ILD, if we have a good timeline and we can check whether that medication has been previously linked to cases of pulmonary fibrosis, we can sometimes make a connection. Now, there is an interesting website that I would leave in the description below. It's called Pneumotox. Anyway, so Pneumotox is a database, a collection of case reports and articles and publications that associate different drugs to lung toxicity. So Pneumotox. So that's a good resource. The simple way to search Pneumotox is to put the name of the drug, and then you will get a star with a number in it. If the number in the star is high, so 5, let's say, or 4, there's a high likelihood that there's a correlation between that drug and lung fibrosis or all kinds of lung toxicities. If the number's low, there are very, very few cases reported. So that could be a ballpark estimate of whether a specific drug that you may be on has the potential to cause lung fibrosis or other lung problems. But that's something that is more reserved for healthcare providers, so I wouldn't necessarily advise you to look up all the list of your medications, because in most cases, most people do not have all the side effects in the world with medication. So it's really, really important to kind of see things in a nuanced, balanced, and common sense way. Hopefully this was helpful. If you have further questions, do leave them in the comment section below, and I'll see you in future videos. All the best. Good health.